information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living. Hi, my name is Dr. Verloy Lewin, and I'm your host today. Our guest today is Azuree Williams. She is the Events and Program Manager at Bermuda Cancer and Health. She's going to share with us on the topic of SunSmart. Hi, Azuree.
Hi, Verloy. How are you?
I'm good. Thank you so much for joining us today. We're glad to have you here today as sun is shining outside. Beautiful Bermuda day. Mm-hmm. And so before we get into our topic on the SunSmart, just tell us a little bit about your role at Bermuda Cancer and Health.
So I've been there for just over 10 years, a whole decade.
Wow.
And initially, I started as the SunSmart coordinator. So I was specifically just doing education, just doing the SunSmart program. And now I have been doing the events and education for the last 9 years. So on top of, that to make 10. And I have had multiple certifications. I am now officially a certified nonprofit professional.
Congratulations.
So that's a very high level designation that it was a 6-month course and it's out of the U.S. So this is the only designation for the nonprofit, like the highest designation you can receive. And I'm happy that I was able to complete it.
Yeah, it's wonderful.
I am a certified global educator for the Know Your Lemons program, a.k.a. Lemonista.
Yes.
We also have other education programs that I'm responsible for. I've been the Relay for Life chairperson for the last 7 years. So it's so many things.
That's a big event.
Yeah. So many things I've been involved in with Bermuda Cancer and Health
you do
Center.
The breast cancer walk as well?
Yeah. So I was the event manager for that from our side because we work with the BF&M committee as well. Okay. We have Man on the Run, which is another, the AXA XL Man on the Run, which is a male-only event.
Right.
We also have our Movember. That's another event that happens during Men's Health Month.
Yes.
But all throughout the year, we have our free education program. So I am constantly on the radio and doing things like this today.
You know what I missed? I missed the men's health event that we used to do, but I'm not going to talk about that. I'll just put that little plug,
event.
The plug in there. Maybe it might come back one day. I don't know, but I think it was a really effective event.
It was well attended.
And it was well attended as well. But today we're here to talk about SunSmart as we are entering into that time of year.
Yeah. Summer's here.
Yeah, summer is here. So what is the SunSmart program? What is it all about?
So basically, the SunSmart program was founded over 25 years ago to introduce SunSmart behaviors or sun-safe behaviors to young people so they start practicing sun-safe behaviors at a young age because skin cancer occurs over time. However, there is a high number it's more common in people ages 15 to 29. Okay. And so, you want children, young people to be practicing the sun-safe behaviors, the 5 S's, while they're little. So the SunSmart program is a free education program teaching people how to reduce their skin cancer risk or their melanoma risk, which is a serious type of skin cancer. So we go into the preschools, we do primary school presentations, we hit the middle schoolers through the Endeavor program. We have a partnership with them. Right. So we're in Dockyard and St. George's every week that they're active throughout the school year. And then we even offer it to high schoolers and corporate lunch and learns as well.
Okay.
Yeah.
So it's basically for a children age group, and you said it was free. I was going to ask you if there was a cost associated with it, but
it's really focusing on youth and young people so that they can learn how to be sun safe at a young age, and by the time they're adults, they're so well established with those habits. However, we also have the SunSmart accreditation training program. Okay. So it's still under the SunSmart program. but it is primarily focusing on summer camps. So making sure that summer camp providers, their staff, are realizing and having the understanding of what it means to be Sun Smart, how you model those behaviors, because best practice and modeling those best practices is what the young people are going to copy and imitate. Because sometimes, you have summer camp providers and they're like, oh, we can't get the children to put on sunscreen. They won't put on the hats. Are your staff doing it? Because they'll say, students or campers will say, well, if the counselor doesn't have it on, why do I have to do it? Definitely, it's a well-rounded training program. We have an hour-and-a-half session. We have 3 sessions we offer every June in the evening, and it's free again. And what we do is we go through a presentation showing them what the dangers are, what the signs are, what the prevention measures are. Again, the 5 S's, slipping on protective clothing, slopping on your sunscreen SPF 30, mineral-based, also sliding on sunglasses, and using slapping on a hat that's a broad-brimmed or bucket hat, so that you give your face, entire face, and your neck and ears shade. So we go through all of this, and then we also assist them in writing a SunSmart policy, so that parents, staff, and campers can adhere to the policy and be on the same page. And then we do a camp assessment, and we go out into the field and we do an observation. So it's a spot check, so they don't know we're coming. We require them to give us their schedules. We go in and we just quietly observe and write our notes. And the camps have to have a score of 70% or higher in order to pass and become accredited, so that they can advertise through their promotional items and communications with parents and the community, letting them know they are a SunSmart accredited camp. We put them on our website. We also provide them with free emergency supplies, hats, sunscreen, and sunglasses for their campers.
Wonderful.
So it's huge.
So is this required for every camp? Is it a requirement, or is it?
No, it's not mandatory.
Not mandatory? Okay.
Unfortunately, we get so many calls from parents saying they're looking for a SunSmart accredited camp, and they notice the camp of choice for them is not on the website or our website listed. And so really we're telling parents, you need to be advocates, encourage your camp to your camp of choice to get SunSmart accredited. It's free. So every year we have new camps, and then we also have camps who reaccredit. So they have to reaccredit every other year. It's not like, okay, you just say you did the program and yeah, exactly. They have to come back for refreshers, and information changes over time, so we update the presentation. Government does really well with their summer day camps.
Wonderful. That's good to know.
They're always reaccrediting. They do very good. Hopefully more and more private camps can get on board and do the training. And but folks can go to our website, cancer.bm. We have all the information on the SunSmart program there. And then folks are always, it's also easy for them to register as well if they want to do the accreditation training.
So if, as you said, they can go to the website if they want to find out more information, and you provide all of those resources. I mean, come on.
Free.
Free hats and sunscreen. So let's talk about sunscreen then. What type? I mean, there are all sorts of things out there, from... you see ones with those high numbers and then the lower numbers. What does that mean?
It's so confusing for people.
I mean, what should I look for when I'm purchasing sunscreen?
So our recommendation, based on extensive research that we've done, interviewing certain sunscreen providers for one that we decided on we were going to use as our giveaways to the summer camps. We recommend mineral-based sunscreen, SPF 30 to 35, ensuring that it is broad spectrum, which means it protects you from ultraviolet A and ultraviolet A, or UVA and UVB. And then the higher the numbers, you want to make sure your main ingredient is zinc oxide. Other safe ingredients that fly in the green zone, because you have to think green zone is safe, red zone is dangerous. So in the green zone, we have avobenzone, we have zinc oxide, and titanium dioxide. So those 3 are the safe ones, that you want as your active ingredient. The ones that would be in the red zone would be octinoxate and oxybenzone, and they're in over 95% of chemical-based sunscreens.
Really?
Those 2 ingredients are also banned from certain countries. Hawaii banned it, Mexico, the island of Bonaire, the island of Palau, and Key West, Florida.
Does that have something to do with the
coral reef?
Coral reef,
yes.
Yeah.
So
okay.
oxybenzone and octinoxate are actually endocrine disruptors, and they've caused bleaching on the coral reef. So the reefs are dying, the corals are dying. And if it's an endocrine system disruptor, it's disrupting the hormones, right?
Yeah.
So think about us as humans. We have an endocrine system. So what could it be doing to us? That research hasn't been...
The skin is the biggest organ, right?
Right.
So,
largest organ in the body. We
Yeah,
absorb everything to the skin.
Yeah.
So it's so the University of Tel Aviv, they did an extensive study years ago. I want to say back in probably like 2016, and they shared the results, and that's why these countries decided they were going to ban these particular sunscreens. So Hawaii, that's where the study was conducted, and they found that the reefs were dying, the coral reefs weren't doing so well, and they wanted to do something about it. So Hawaii has, they're known to make their own eco-friendly sunscreen as well, which we've had here in Bermuda. We actually purchased it as part of our program at one point.
Sure.
It's a really good sunscreen. It's very pasty. A lot of people don't like the zinc. You just
it gives you that hue, right?
that pasty, milky looking. Yeah. But you just use less. Yeah. But you want to be protected and reduce your skin cancer risk.
Yes.
So there are sunscreens that don't have zinc oxide in them that are not pasty, but they're still mineral based and safe for the marine life, the ocean life, as well as us. So I do recommend to people to check out EWG.org. That stands for Environmental Workers Group. It is private, it's non-government funded, it's based in the United States, and they give you the good, the bad, and the ugly on sunscreens.
Okay.
They do extensive research, and they take the products and break them right down and tell you what ingredients are carcinogens, human carcinogens. Some sunscreens can actually cause cancer.
Wow.
The chemical-based ones. So you should be, as a consumer, be informed, read the ingredients, make sure you're looking at the main ingredient or the active ingredients, zinc oxide, titanium dioxide, or avobenzone. And then you want to also make sure that your number is 30 to 35. Most sunscreens that are 50 and higher, they tend to be chemical based.
Okay.
Some of the mineral based are high, but you want to be able to read the ingredients natural as possible, because you are putting this on the largest organ in your body.
Right.
Yeah.
Right. Wow. Oh, that's a lot of information. Where do I want to go next? What is ultraviolet? You talked about the UV rays, and what is that, and why is it dangerous for us?
So basically, the ultraviolet rays, that's where the radiation from the sun is coming down through the rays. And a lot of times we don't realize that even on cloudy, overcast days, people don't think they're going to get sun damage. Radiation is what causes the sun damage. Don't panic though. Radiation's good for us when it's coming from the sun. The sun is giving us an abundance of free vitamin D. So we need to go in the sun in order to absorb that vitamin D for about 10 to 20 minutes. If you're really light, 10 minutes. The darker you are, 20 minutes, a little longer, because of the melanin in your skin. Melanin acts like a natural sunscreen. So it's hard. It takes longer to absorb that vitamin D. But skin cancer is colorblind like any other cancer. You can be subject to sun damage and in turn skin cancer and the most serious form, melanoma. So the radiation levels that are coming down from the sun, you have to exercise moderation. Because yes, we want vitamin D, but we don't want skin cancer.
Right.
So if you're out in the sun for long periods, whether you're a roofer, a landscaper, Any kind of outdoors work, if you're a caregiver and you're taking your children out, you're a parent, you're taking the family out for an excursion, whether it's beaching, a beach day or a picnic or boating, or even just taking long walks in the sun, you have to make sure that you're putting on proper protection, like the UPF in the clothing, the sun protective clothing. So SPF is for sunscreen, UPF is for clothing. You can go as high as you want with the clothing because there's an ingredient built in the fabric that works just like sunscreen. So you want to make sure that you're protected. That way you're not absorbing too much radiation from the sun if you're out for a long time, because over 95% of skin cancer cases are attributed to overexposure to ultraviolet radiation. So if people are not out sunbathing, which so many people in Bermuda are addicted to, course, subtropical, right? It's beautiful.
To do that, right?
Exactly. But you also have tanning beds in other countries. So there was a skyrocket in skin cancer cases. Back in 2016, the U.S. Surgeon General made a call to action for skin cancer because the cases were alarmingly increasing and getting higher, and it didn't seem as if it would decrease, and that was based on people being addicted to tanning. So
wow.
Yeah.
Well, something you said about vitamin D, and a lot of people, some people I've talked to, they have low vitamin deficiencies, and I'm like, why?
Avoiding the sun.
Yeah, avoiding the sun. Yeah.
And constantly. So it's like a catch-22. You want to be moderate with your sun, how much time you're spending in the sun, but also if you're slathering on sunscreen all the time and your skin's not getting a chance to breathe and absorb the vitamin D, sunscreen is also making it's preventing you from absorbing that vitamin D.
So I guess it's I've read it's early in the morning is best.
Before 10 in the morning.
Before 10 to go out
and then after 4. But folks can always just, if they're not sure and you want to be absolutely sure to plan your excursion or whatever outdoor activities you're going to be engaging in, just go to weather.bm. We have a partnership with the Bermuda Weather Service, and there's they record the radiation levels in Bermuda in real time throughout the year. They use a radiometer, which is a device that records the radiation levels. The only time the radiometer is not in service is when they send it back to the Netherlands for recalibration to make sure everything is in working order. But they're recording the radiation levels. They have a graph on their website. They're letting you know when it's going to be peak, when it's going to be low, so you can plan your day accordingly. So there's no excuse. We let the summer camps that do the training with us, we tell them, use this as part of your teaching tools. Endeavor uses it every week when they're doing their orientation with their students. Every time they have a new group, they're showing them the graph and they're recording the UV index, so they know we're going to be out in the water and we need to be prepared.
Yeah. So it's not preventing you from going out, but just being prepared when you do go out.
Being sun smart.
Yeah, sun smart. That's what it is. Yeah. It's interesting. I'll give you a personal. I was sitting outside. And it was April, and it was still cool then. It wasn't hot yet, and I was just sitting outside. I didn't think I was out there very long. Well, I was out there long, but I ended up getting an umbrella and sitting on there. But the next day I went home, I had rash all over, like I had never been in the sun before in my life. And I was like, what is this?
Oh my goodness.
Yeah, and it was like, it wasn't sunburn, it was just like a rash that came up.
Heat rash.
I'm like, I guess all of that cool weather we've been having
your body wasn't ready for the sun. Well, and also, some people are actually allergic. They have allergic reactions to the sun because their skin's sensitive. And then folks also aren't aware that even on cloudy days, 80% of the sun's rays are penetrating the clouds.
Right.
So some people are like, there was no sun
out.
How did I get burnt? So
you
just have to pay attention, be a little more informed about your surroundings and what the UV index means and how it can impact your health.
Yeah. Well, we're in the peak of summer now, so I know this is going to be very, very helpful to everybody who will be listening. Is there anything else you'd like to share with us as we wrap up this segment?
Just encouraging folks to be sun smart. Go to our website, cancer.bm. We have a huge selection of information. Our SunSmart presentations are free from preschool age all the way up to corporate, so they can go online and book a presentation today if they want. And the SunSmart training for summer camps is open. The registration is open, but it will close the week before we do it, and we only do the training in June. So we get calls all throughout the year, but the training's only in June, right before the camp
summer
starts.
Camps start. Yeah, makes sense. Yeah, definitely. Well,
Yeah.
thank you so much, Azuree. This was very, very informative, and I appreciate you coming to speak with us on SunSmart. And thank you, audience, for listening today. And keep an eye out on this spot for our next episode of Health-Abets. Take care and be SunSmart.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.